We know how exercise and sports can reduce the risk of certain cancers and how they can affect the long-term outcomes of these patients. But what are the beneficial effects of physical activity and exercise during cancer treatment?
Well, this is of course a very, very broad question, and the effect of exercise as a medicine in the management of cancer goes right across the spectrum from immediately post-diagnosis in the preparation of the patient for their coming treatments. As one example, this would be to get them as resilient as possible in preparation for their surgery. It is in treatment as well. Exercise medicine is critical to reduce the side effects of chemotherapy and radiation therapy, but also emerging evidence is showing that appropriate exercise medicine will actually enhance the effectiveness of chemotherapy and radiation therapy. And of course, exercise medicine is crucial to help the patient to recover from their treatments and or surgery. And so here exercise medicine is a rehabilitative treatment to help them recover their physical fitness, but also many therapies and surgery will cause detrimental changes in body composition, such as increased fat and lowering of muscle, reduced cardiorespiratory fitness, and as a priority that must be addressed. And so exercise medicine highly effective at actually helping the patient to recover. In the long term, of course, once they are a cancer survivor, then it's exercise medicine. They have to continue to be physically active and to do exercise regularly to reduce their risk of the cancer coming back, so in other words, recurrence, but also to reduce their risk of developing other chronic diseases such as cardiovascular disease or metabolic syndrome.
Is it important to do strength training? And which is the role of eccentric strength training?
Well, the research is quite conclusive, and certainly in my own clinical practice, strength training, resistance training is a critical component of any exercise prescription. And this reason is that the maintenance of muscle mass is very, very important for patients with cancer. There's clear evidence that patients who have low muscle mass will have a much higher risk of cancer-specific mortality. And also, when they're undergoing treatments such as chemotherapy, patients with low muscle mass experience much higher levels of toxicities or side effects of chemotherapy. And that means, of course, that they may have greater reduction of dose. And this again compromises their capacity to overcome the cancer. Eccentric training is a very important part of this, and we use this extensively in our research and also in clinical practice. And the reason being that the eccentric mode, the lowering phase of strength training, has a strong drive, a hypertrophic drive for the muscle to either maintain size or hopefully actually increase size. For many patients, they will have sarcopenia. Around a third will have low muscle mass. And so this needs to be addressed as a priority. So it would be very unlikely, certainly in our clinical practice, where a patient with cancer would not receive a considerable dosage of resistance training or strength training included in their prescription.
Is there any target exercise therapy for certain cancer patients?
In our 2019 position statement in Australia for cancer management with exercise medicine, we did propose a more tailored or precision approach in the prescription of exercise medicine. Prior to this paper, there was a generic recommendation of 75 minutes of vigorous exercise up to 150 minutes of more moderate exercise per week, and that all patients should do 2 or more resistance training sessions each week as well. And this is fine as a generic recommendation for many patients who are coping well and are relatively healthy. However, many patients will not be doing well. They will be struggling due to the disease, but also the various treatments that they receive. And so it is critical that a more tailored exercise prescription be applied. There's many mechanisms by which exercise medicine actually suppresses cancer growth, and this is being increasingly well established in the research. I think a particularly exciting area is the way in which exercise can be used to manipulate and supercharge, if you like, the body's internal immune system to fight their cancer, to actually help them to overcome the disease. And the pathways through which this operates is certainly through various myokines released from the muscle and their interaction with natural killer cells and also T cells to, if you like, help the patient to develop an actual cancer immunity or an immune response to fight the cancer. And this is a particularly exciting area, and our team has demonstrated considerable elevations in these anti-tumour myokines, and also when we apply the serum from these cancer patients that have been exercising, we apply it to living cancer cells, we see a suppression of growth of around 20%. So this is an area for considerable research, but also direct application in how we prescribe exercise for these patients to create an anti-tumour environment within their own bodies through the use of exercise medicine.
Should we prescribe high-intensity exercise training?
So the research evidence is quite strong now that we require a moderate or even a vigorous intensity of exercise medicine, both aerobic or cardio exercise as well as resistance training, to induce the adaptations and the acute responses within the body systems to help the patient to fight their cancer. Low intensity exercise will not cause sufficient disturbance to the homeostasis within the patient to achieve the internal medicine to be produced. And so for our patients, what we prescribe here is in general moderate to vigorous and at times highly vigorous exercise, both, as I say, aerobic but also resistance training, because we are trying to stimulate the patient's internal systems to produce myokines, a strong immune response, to activate natural killer cells and other T cells, and also to create a hormonal response as well. The other aspect to it is we're trying to drive actual structural changes within the patient, such as stimulus for muscle growth, fat reduction, and a stimulus to maintain or improve bone health, bone density. This again requires quite a vigorous intensity of exercise medicine.
Can we apply precision medicine with individualized exercise prescription for cancer patients?
I believe we are rapidly moving towards a strategy of using precision medicine to prescribe a highly tailored exercise prescription for the patient, each individual patient. And this involves assessing the health and fitness of the patient, combining that with their goals and their accessibility to therapy, and then designing an exercise prescription which is highly effective, it's optimised, it is doable, achievable for the patient. So yes, I think the future is precision exercise medicine.
What is the psychosocial impact of physical activity and sports when patients reclaim the control of life after cancer?
Importantly, one of the key benefits of exercise medicine for a patient with cancer is the improvement in their mental health and their quality of life. And it's clear from the research, but also my clinical experience as well, that patients feel much lower levels of anxiety. Their quality of life is improved because they are physically and emotionally more resilient, and so they cope better with the cancer itself, the fear of their own mortality, and also they cope better with the treatments. They have less side effects, and so quality of life is better in patients that are physically active, and also that contributes to their better mental health.